Hello, my name's Scott Harding-Lister and I'm an intensive care clinician and also a lawyer. I'd like to thank you for joining us here at Apex Health Associates for us to talk about the National Early Warning Score in the adult patient population. Just a quick mention about Apex Health Associates. We are a specialist healthcare medico-legal practice and we provide medico-legal expert opinions to the legal, professional and insurance sectors. So what is the National Early Warning Score or the NEWS score? Well, this is a clinical tool which can be used either in primary or secondary care settings. So that is, it can either be used by community clinicians or it can be used by those which are in the acute or hospital sector. And it's a scoring system which is used by carers or clinicians to assess the severity of a person's illness. And from that assessment, it helps determine the urgency of the required medical intervention. The aim, of course, is that it helps early detection of a deteriorating patient. And so with that, it's hoped that the person who is deteriorating will have medical intervention put in place as quickly as possible. So what are the components of the NEWS score? There are 6 physiological parameters which are assessed and scored. These include the respiratory rate, the oxygen saturations, so how much oxygen is in the blood, the temperature, the blood pressure, the heart rate, and also a level of consciousness. Each of these physiological parameters is assigned a score, and this score is dependent on how deviated it is from the normal range. And the scores for each of the parameters ranges from 0 to 3. A total NEWS score is the sum of the individual parameter scores combined. The higher the score, the higher the risk and the more urgent it is for the person to have medical intervention and to be escalated. On your screen now is a NEWS observation chart and scoring chart which demonstrates how it is used in clinical practice. On the chart, which is a colour chart, the observations are entered onto the chart, and at the bottom a NEWS score is able to be calculated, and then the person is escalated according to the local policy for each of those scores, and really importantly, how often they are to be continued to be monitored. So how often their observations are to be repeated is also documented on the chart in accordance with the local policy. So dependent upon the NEWS score is dependent upon the action which is to be taken. The higher the score, the greater the risk. And therefore, the action and escalation is dependent upon the local arrangements, but if there is a higher score than is normal or is expected, then that patient would be escalated to more senior staff for their involvement in their care and for an assessment. And if they are also triggering on the NEWS scoring system, then there would be an increase frequency of how often they are to be monitored and for their observations to be repeated. So the introduction of the National Early Warning Score system has been a game changer. It has allowed for the early detection of sick or deteriorating patients or residents. This has meant that it's improved patient safety where it's used. It's standardised communication between staff. It's enhanced training and education for healthcare staff, and it has saved countless lives. As nursing and medico-legal experts, we praise the NEWS scoring system as it has clearly helped detect people that are deteriorating and help save their lives by getting them in front of more senior clinicians as quickly as possible. But of course, there are always problems, and this is where we have become involved as medico-legal experts. We are usually asked to comment on cases when things have not gone according to plan or as to policy. And we've been looking at this scoring system and have been involved in cases over the past few years. And in our experience, we have found that the majority of the problems which we have been involved with are based around human error rather than the scoring system itself. And that human error has been with staff not using the scoring system as it should be used, or being unaware as to how it should be used. So they may have, for example, incorrectly calculated the score. They've incorrectly calculated the scores from the 6 individual physiological parameters. They may have calculated the score correctly in some other cases, but then there has been a failure to escalate according to the healthcare policy for their environment. They may not have reported deterioration to their seniors, and in addition to getting the scores wrong or not escalating according to the policy, we've also found on some occasions and in some cases that they didn't increase the observations according to the policy within their area, and therefore there was a lost opportunity to identify people that were deteriorating over a period of time. So thank you very much for watching this brief presentation this afternoon on the National Early Warning Scoring System. I'm sure you'd agree this is a very simple and a very helpful tool within the clinical environment to try and identify people that are deteriorating and to get them additional medical help. As with any scoring system or clinical initiative, there are limitations, and I've discussed with you some of those limitations that we have found as nursing and medico-legal experts. If you do need a medico-legal opinion, then please do get in contact with our offices and we can see if we can assist and help you. For now, bye-bye.